Loss and chemotherapy, well, they seem to be something that go hand in hand for those that are going through cancer treatment.
However, a new clinical trial at Montefiore is testing out a new technique for women of color that may save their strands. News 12's Aisha McKenzie has this story.
So how did the first cycle of chemo go?
Good, not so bad.
Good.
Alta Grace Pellissier received her life-changing breast cancer diagnosis back in June in Haiti.
I felt a little mass in my left breast.
While in her native country, she got the tumor that the doctors found removed and was ultimately sent to Montefiore for cancer treatment. And chemotherapy was not foreign to Pellissier, as she witnessed loved ones go through it too.
I have some friends who passed through this problem, and they told me, it's not easy. And I have a friend I see when she was losing her hair. It was terrible.
But through a clinical trial for women who are most at risk for permanent chemotherapy-induced alopecia or hair loss, Pellissier may possibly see a different outcome from chemo at Montefiore Einstein Cancer Center.
If there is a way to have your hair in your head, then I accept it. I should accept it.
The clinical trial is a different approach to what is called scalp cooling. Traditionally, it is wetting a patient's hair and putting on a cap so the scalp is cold and chemo can't reach the hair follicles. But for Black and Latina women whose hair volumizes with just water added, this method does not work as well.
The idea is to coat the hair instead of just wetting it with water, to coat it with conditioner and water, and then loosely braid or twist the hair, working with that patient's what they know about their hair, what styles work for them, in order to minimize the volume and get that cold temperature through the hair to their scalp.
The goal is to bring equity to care and outcomes.
We actually see patients who decide they don't want chemotherapy, or they may choose a less effective chemotherapy just because they don't want to lose their hair. And we know that cancer outcomes are already worse in this patient population. And so anything we can do to improve and lessen